Hello, everyone. As you know, I am Amanda and we are here for Amanda Meets. And I am so excited because I'm talking to someone who is so aligned with skin health and the dangers around sun. Although he is in a different vertical, he is not in self-tanning, but he is trying to make sure that your skin looks beautiful and is protected and repaired. And it is Dr. David Jack. Hello, Dr. David Jack.
Hi, Amanda. Thank you for having me.
Absolute pleasure and honor.
Thank
you for taking the time to sit with me and just have a chat. I know it's late.
It's quite all right. Quite all right. I don't have anything else going on this evening, so it's lovely to talk about skin.
Exactly, and there's no real sun outside, so you know, we're both in black and look like we're in the middle of winter and it's in the middle of May.
Exactly. I know.
But this is actually a really, really good time because I know it's Sun Awareness Month.
Yep.
Skin Cancer Awareness Month. Mm-hmm. I have a personal connection to skin cancer because it is in my family, and hence why I do what I do, and I try and promote safe sun, safe tanning, self-tanning, whatever we call it. So I'd love you to explain who you are and what you do so brilliantly.
Sure. So I'm an aesthetic doctor. I've got a clinic on Harley Street, and I also have a skincare brand, which is named after myself, similar to yours, Amanda. And my background is in plastic surgery in the NHS. I studied for quite a while in burn surgery and also skin cancer. And I did a lot of operating in the skin cancer world. So for some complex skin cancers, skin cancer reconstructions. And so I've had quite a lot.
What would that look like typically?
So anything from excising little moles and sending them off for analysis to sort of flat reconstructions of skin cancers, and also kind of clinics looking at lots of different skin cancers, from when I was working in Scotland to when I was living and working in London. So I've seen a lot of melanomas, a lot of BCCs in all sorts of patient groups, particularly in Scotland, which you may know is the sunbed capital of the world.
I was going to say, please explain, because I know about this, because we've talked about this. Please share like how many patients you saw.
So I saw thousands of patients in Scotland with melanomas, even as young as mid-20s, who were avid sunbed users, who had significant melanomas, and some of whom actually died in the end from melanoma as a result of sunbed use. And very often you would see young people who are as bright, like very pale Caucasian people who were absolutely mahogany because of excessive sunbed use. So I think it's a real issue, and it still continues to be an issue to this day. So I think there's a lot to address there, even still, despite all of the skin cancer education that's happened over the last couple of years. It's still a massive issue.
It's a huge issue, and you don't really, you know, what I see is I don't see it.
Yeah.
You know,
exactly.
It's you know, I see a lot of other, you know, promotions around cancer, but skin cancer, you know, the stats are insane. You know, 9,500 people in the US contacted every day, and 2 people die every minute. I mean, those stats are amazing. So
it's crazy. Yeah.
Hopefully they'll ban sunbeds soon.
Hopefully, it needs to happen. For sure. Yeah, absolutely.
And then we will follow suit. Again, no one's talking about sunbeds and UVA.
No, and it's something that is actually a lot more widespread, I think, than people realize. There still is in most areas a tanning salon. Even down the road from me here in Notting Hill, there's a tanning salon down at the bottom of my road.
Tell me who's going in. Is it men?
It's both, both men and women. And surprisingly, I mean, I know quite a few men who, despite knowing me and listening to me talk about skin care and skin cancer and protection, still go to tanning beds. So it's it's quite scary actually. So yeah, and I think
I was with a couple who are avid sunbed users.
really,
And I went round to tan them both, and they said, you would turn me off going to the beds, and good. That's the mission. That's
totally.
That's what we've got to do. So I know we've got some scary stats, but can we just move to what you offer? Obviously you've got your treatments and you can repair the look of sun damage, but we'll get onto the skincare bit in a minute. So how would you see sun damage? How would one see sun damage?
So there's a number of things that you can recognize in your own skin that are related to sun damage. Firstly, pigmentation changes, and these can be in different forms. So from kind of simple freckles that appear more when you have been exposed to UVB, to solar lentigos, which are kind of more patches, so brownish stains on the skin, to much darker marks, and also melasma as well, which is related to kind of sun exposure in combination with hormonal changes as well.
That's right.
And often with melasma, what will happen if you go in the sun, any melasma that's there will darken. So there is a contribution of UV exposure to melasma as well. The other thing that sun does, UVA in particular, is it penetrates quite deep into the skin. So you get thinning of the dermis layer, which is the deep supporting layer of the skin, which is where all the collagen and elastin is. And that over time thins, and wherever muscles are inserting on the skin, you get the lines and wrinkles developing, and also volume change. So UVA can penetrate even as deep as the fat in the face. So over time with sun exposure, you notice that there'll be a reduction in the fat volume in the face. So particularly sort of around about the most sun exposed areas, everything will start to drop down because you lose some of the fat that's there. And that's a sure giveaway sign that you've had some sun damage. And often people find that as they age, they get increasing amounts of that fat loss, which is a lot is down to UV exposure. So there's a number of different signs that you can look for, but primarily pigmentation change, and then volume loss, and fine lines.
Even if you experience the sun damage when you were 20, it will show up later.
Yeah, even as young as children. So childhood sun damage is kind of paving the way for these changes later in life, because the earlier that you injure these melanocyte cells and the keratinocyte cells that are in the skin producing new skin and pigmentation, the earlier the initial damage happens, the more cumulative damage happens to the cells and the DNA in the cells. So that's why you kind of accumulate damage over life. So it's really important, even in children, to protect skin against the sun. And it's precious young skin that you have to really be careful with.
So is there any point in, well, yes, there is a point, obviously, of using SPF every day, which is what we all do, hopefully. So when do you advise, because when I was young, we were told to start protecting the skin in your 20s and maintain in your 30s, and then protect and treat in your 40s. So where are we now? Because I'm old.
So the protection should be from early on in life. Whenever even a child is out in the sun, they should be wearing some protection. I mean, it should be covering up initially. And then, I mean, if you're in your teens and you're exposed to UVA light, you're still going to get damage there. So it's very important to kind of hammer in this education about sunscreen use, because the damage just cumulatively happens over life. So using it protection throughout life is really important. When to start using things like antioxidants on the skin, I think that can be from the late teens. So using, say, an antioxidant serum like vitamin C, I would say that kind of the earlier the better, because you're also protecting the skin, and things like vitamin C do offer some additional protection in addition to a sunscreen. So I would say the earlier the better.
Thank you. That's what we need to know. Can we possibly just touch, before we go into how to protect every day, could you possibly tell us how to and when to treat skin damage, so sun damage? So if I had melasma, so guys, by the way, melasma it forms in a big cluster of freckles, so it would be a darkening of the skin in quite a large area. You see it hormonally, you see it in pregnancy, and also it can just come up around the jawline, but also I see it a lot on the forehead, and I stipple tan, for instance, to even out and cheeks, okay, there you go, to even out the skin and the color. So I've been told, and I do normally, is laser treat in the winter.
Sure, yeah.
There's less UV.
Sure.
Filter. Yeah. Is that right?
That's right. If you are using laser treatments, then it is better to do it when there's less UVB, which is in the winter time. I would say that you can treat pigmentation from all the way from skincare up to laser treatments.
Okay.
Sure. So,
nice.
So things like vitamin C and E are substances, they work to inhibit an enzyme called tyrosinase, which is in the pigment cells. And anything that inhibits this enzyme will prevent the production of excess melanin. So vitamin C, vitamin E work together to do that, and they're found commonly in skincare products over the counter. Vitamin A is also a tyrosinase inhibitor, so that is also, again, an over-the-counter thing. So all of these things can be used pretty much throughout the whole year to treat pigmentation and also protect against future development of pigmentation, regardless of the type of pigmentation you have, whether it's melasma, whether it's solar lentigos, or just kind of other kind of patches of freckles and things. So that's kind of the first phase of treatment, and you can do that year round. Moving on to things like stronger chemical peels that you can do in clinic. Sometimes I would say just do those in the winter time if there's any downtime and you just don't want to be exposed to the sun. After you've had these sort of treatments. And there's peels, things like lactic acid, mandelic acid, work very nicely on pigmentation. Also deeper peels as well, with things like phenol, and also deeper retinol peels. They would be best done probably in the winter time. And then, on you go, Amanda.
David, whilst you've just brought up retinol, please can you explain exactly what retinol does? Because I'm not sure that everyone understands when to use it, what it does, and how often. Yeah.
Okay. So retinol is basically the active form of vitamin A, which is a vitamin that has loads of processes throughout our bodies. When you use it topically on the skin, it has a number of effects. Firstly, it can sort of repair DNA damage. Secondly, as I said earlier, it's a tyrosinase inhibitor, so it can reduce the production of pigmentation. It also has quite a strong effect on the fibroblast cells in the skin, which produce collagen and elastin. So it has a collagen stimulating effect as well. So collagen lost through UV damage, it can help to repair that. And it also exfoliates the skin, and it also reduces the production, or balances, I should say, the production of sebum. So it's like a wonder molecule. The drawback of retinol is that it's quite drying on the skin. You get this retinoid effect when you start to use it often if it's too strong. So you get peeling and you get drying of the skin. So it's really important, if you're using retinol, then you start kind of gradually, maybe using it once a week to start with, twice a week after a week or so, then increasing it to maybe every second night. There are, however, lots of different forms of retinoids, which are basically different forms of retinol that are converted to the active form on your skin. So, for example, I've got one in my range that's called Goodnight, which is a retinol palmitate, which undergoes 2 conversion steps on the skin, so it's very gentle. And that one is totally fine to start every day for pretty much any skin type, and it's not going to really dry your skin out. There's other forms like tretinoin, which is a prescription retinol, which is the active form that actually does the work, which is only available on a prescription. If you were to start that once a day right off the offset, you would dry and peel, and your skin will look pretty horrible. And it's probably a bit too harsh if you're just doing it for kind of anti-aging purposes, but good obviously for pigmentation, for acne, these sort of things. So and there's a few kind of intermediate ones which have been developed. There's one called Gran-Active Retinoid, which is a 4th generation retinoid. Again, it's converted to retinol in the skin, which is a lot more gentle, but still has the same effects as retinol on the skin. So if you're starting out on a retinol or a retinoid for pigmentation, then I'd suggest just really starting a gentle one to begin with, like a retinol palmitate. You can use that every night quite comfortably, in addition to things like your vitamin C in the morning, and then gradually either kind of introduce a stronger one maybe once a week, and just build that up so that your skin is tolerating it, so you don't dry yourself out too much, and you can gradually build things up to using a retinol every day, and that will give you kind of the best benefit.
I have one that I get from Amazon.
Sure.
It is so rogue.
You're
it's
not
from France, and it's literally like putting an oil slick on. Don't sleep. Absolutely don't sleep, because you wake up with a burn. It's so illegal. But I wake up looking like a Barbie doll, so I can't.
I know, it's so tempting to do that. But if you're doing that every night, then it's just
no, I'm not, but I have started putting it in my body creams.
Have you? Okay. Yeah. Just blend it in.
Blending it in. Exactly.
I think actually for the body, it's also, you've obviously, the skin is the same on the body as the face. So
of course,
using these things on the body is.
I know, and no one's really doing retinol body creams.
I know. Exactly. Don't worry, I've had this thought already.
You should, honestly, because us goons are just doing it ourselves. Just before I let you go, can we do a little treatment together?
We can indeed. Yeah, let's do that.
So everyone, this is how I do my protocol, which is combining safe sunless tanning with SPF, because I get asked all the time, when do I put my SPF on? Can I put serums under your tan? Absolutely. And when you've answered it, when do we do the retinols? The retinols are at night.
Yeah.
You don't do your retinols the same night as tan. Just do your retinol on a Tuesday, and then we revisit the world of sunless tan on another day, because as David says, it dries your skin out, and it's trying to do a lot of repairing, and we're just making you look gorgeous and glowy, and we're at protection stage at this point. So have you got my pads?
I have them here.
Okay, great. So this is I'm a cosmeceutical girl, and I like using acids to exfoliate. So exactly what we've been discussing. It's the same as David. They do not scratch the surface. They actually do all the hard work for you. And I like glycolic. Some people don't. Some people like salicylics, but glycolic for me, light level, is awesome. It just works. Biodegradable cotton pads, so I only want you to use one, but we just refresh the skin. It's got a lot of hyaluronic in it. I balanced them out. So really refreshing. And then I only want you to use one pad, no wastage. Flip it over and then do the neck. Polar neck.
Right down.
I gave up on the t-shirt earlier. I was like, what? Absolutely rubbish weather. Okay.
Totally. I know, it's unbelievable.
So that instantly refines and brightens. And cosmeceutical acids as cleansers are amazing for the glow. Okay, I want the glow. Well, then just get it when you're cleansing.
Exactly.
Then add the Vit C for the brightening.
Yep.
Which moves us on to David's insane antioxidant serum, which is, please explain what the antioxidant serum
So
is.
it's a blend of, it's 10% vitamin C, but it's a blend of 2 different forms of vitamin C, which are stabilized so they don't oxidize in the air. And basically one penetrates relatively superficially, and then the other one penetrates deeper into the skin, so it's a slightly slower process. So you're getting that kind of 2 level of vitamin C penetration. Wow. Instead, vitamin C is a tyrosinase inhibitor. It helps to reduce the production of pigmentation in your skin, and also because it's an antioxidant, it helps to protect your skin against future oxidative damage from UV, from pollution as well.
Anti-pollution. Okay, perfect. So aggressors as well. Amazing.
Exactly.
So that is layer 1 of protection. Then we move on to, we're kind of mixing our brands together a little bit, which is perfect because for me, David's are the ones that work the best.
Thank you.
They do. They do. Then you go into step 1, your prep stage, which is your primer, but it's also your moisturizer. We're fans of layering. Very fine layers of different things that you need. So this is hyaluronic, collagen, vitamin A, E, aloe vera, aquasil, polyestop. So again, anti-pollution. And it's low level DHA. So if you do not want to then put on any self tanner for as a man or a woman, whatever, and you want a low level gradual look, just do that. Put your SPF on and get out the door. But we're just going to go one step further because we need the color at the moment because no one's going in the front. Your SPF, broad spectrum SPF 50. It is so light. It is beautiful.
Thank you.
It's air light. It's feather light. It's amazing. I love it so much.
Thank you.
Just put it. That's the protection. Because tanning, yes, you can do it at night, but a lot of the time I love doing it in the morning because I just want that instant color.
Totally. Just
want that boost, and I quite like to go to bed clean and fresh and so it depends depends who you are, it depends when you want to do it, totally up to you. It smells amazing. That
thank you. It's nice and fresh to start your day all day long,
guys. It's so good. It is so good, please. And then I am using my natural rose because I love using. Are you on rose?
I'm on rose as well.
There's a Scottish rose up there.
Scottish rose, English rose.
And you know all of this, so it's just spray straight on. Spray straight. Start on a cheek and buff circles. David's always very light touch with it. It's very delicate.
Very delicate, a delicate Scottish flower.
Sort of taps it on. Like a little painter. Whereas the masculine here, the alpha, just buffs it.
Just buffs.
So we're just doing an all over layer.
All the way up.
Doing it absolutely perfectly. You are. I've taught him very well. You need to put it in the forehead for a man because it's a slightly different technique. You have to really get up the top here and into the hairline to just sort of look, and then buff all the way behind the ears, under the jawline. Just keep buffing. You cannot go wrong. That's
body tanning.
That's better. That's better.
Body tan, you can kind of contour things as well with tan.
I'll do that whilst you're still feather lighting your face. So I always pull my hair back. This is amazing for anyone really. Top line is the top of the ear all the way down, And then you just tap here.
Okay.
And then you push up.
Okay.
It gives you a beautiful
Nice.
Beautiful cheekbone.
Yeah.
And then I just take the excess and I put it above my temple line here. Oh yeah, that's it. I just put a bit here as well. That's it. Yours would be different because you're going
way further back.
Yeah.
There we go. Yeah.
You're going way further back. So do the other one here, like this. So it's tap, 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 sweep into the temple line, and then kind of gives you a beautiful shape. It's 3D. It's like semi-permanent bronzing.
Amazing.
And then I shade underneath the jawline to give you sharpness.
Yeah.
You can get very clever with a little bit on the brush.
Okay.
And then you just flip it like that.
Okay. On the nose. Oh, there's a
side of the nose. Thank you for getting involved.
Yeah.
And then if you want a little bit on the eyelids, you won't, but
might as well try.
Yeah. It gives you a beautiful socket line. It's really subtle.
Okay.
And that's the new trend for the summer.
Oh, I see.
So it makes your eyes pop. It's so good on you. Have you done your neck?
I've done a bit on my neck.
Yes. So especially for men, it's really important not to forget the neck, and also remember, because actually you're far more precise than what I've seen.
Okay.
It's far more precise than the female customers, is that you sort of stop here, and I'm like, no guys, we've got to go behind, we've got to go right the way back, because you do have a neck round the back. Yeah,
of course, yeah.
So everyone forgets that.
Yeah, and same for SPF. I always make sure that that's it. Yeah, do 2 splodges on the back.
Do you remember those hats we used to wear as kids with a little
with the wee thing on the back? Yeah, totally. Yeah.
Oh, there you go. You look.
Thank you. I look like I've been to Ibiza.
You do.
Right.
You look fabulous now.
Great.
Oh, thank you so much.
Thanks, Amanda. It's been a pleasure.
Enjoy your pasta.
Oh, I will do. You've had your dinner.
So thank you very much for being with me.
My pleasure. It's so lovely to speak to you again.
You too. Take care.
Yeah.